Good morning. Hello, hello, hello. How are you guys doing? Well, today is my first dental appointment since my transplant. And as you guys know, I had one about early May. But when I got here, they couldn't see me because I didn't have the clearance form with me. So it was a blank trip. And now I'm back again with my clearance paperwork. Boom, she got it. And UF, UF, UF Health. So everything is okayed for me to go and get my treatment started on my entire mouth, everything, all that. Yeah, I have this funny shaped mouth that, and I get it from my dad's side. All of our teeth are behind the lip, the top lip. And God bless the dad. My dad cursed me with his entire mouth. Yes, he did. So, and even my granddaughter, she has the same shape. So yeah, they're behind the the top lip, and I hate it, but it's okay. So for those who always thought I didn't have no top teeth, they're there. They're just in back of the lip. So I have to kind of like smile big to let them be seen. So they need a good cleaning. I have several wisdom tooth missing, if not all of them. And you all know about the famous bottom that was taken out, extracted right before the transplant, or else I couldn't get the transplant because this was infected, so I couldn't go in with any infections. So you all know about that. So what they're gonna do today is they're gonna be starting on one thing at a time, because my insurance is not like allowing them to do multiple things in one day, which is crazy because I got to keep making these trips back to back, when I can just, you know, at least do two things at one time. But I don't know if they can get a override on that because I have to have so much work done. So maybe they can try to get an override on that. That would be nice if they can. But if not, your girl gonna go with the flow because I finally found a dentist that I don't have to pay such a big, huge copay or this and that and the other, you know, because when I went before to have an extraction, I don't know if you guys remember when I was trying to get help with getting this tooth pulled out because they wanted to charge so much, this, that, and the other. So we finally got that situated. But so I'm here now, just waiting on my name to be called. And as you guys know, they never call you at your appointment time. So I hope you guys have been catching my last few photos of me working out in the gym and my videos. I've been doing quite well in the gym, and my goal is to go at least 3 to 5 days a week. I'm pushing more on the 5 days a week, but if my body is not allowing it, I will do 3 days. That's what I, told myself. So, or if the weather is just too bad to go out, I'll stay in. And if you guys remember, when I had the in-home physical therapy coming out when I was in Gainesville. I still remember all those exercises that she taught me to do at home when I can't get out. So actually, Tuesday I did in the in-house as well. So that's how that went, and that worked out. So this is a no excuse zone for the exercises, and I have so much to tone up, and it's the thing is it's not a big rush, but I don't want to. I got to be consistent with it because once you stop exercising, on a mode, you got to get in that mode. And once you get out of it, it's the starting over part is what you get so lazy and don't want to go back to the gym. So that's what gets you. So that's why I say I gotta keep it up at least 3 to 5 days a week so that my body will be used to going to the gym. And even though it was, because before my transplant, I had to work out every day, and then when well, at least walk. And once I got into the program for the transplant, and well, after my transplant as well, once I was able to get up, I had to go in there every day on my sickest days. Even if it was a 5-minute thing, they wanted you to start somewhere, start gaining your strength somewhere. And that really taught me a lot after my transplant about gaining strength, is because I remember the days that I was able to only go in there for 5 minutes on the treadmill. Some days I can only do 3 minutes on the treadmill, and then I start working my way up to 7 minutes, 10 minutes, 15 minutes, 30 minutes. So as I look back on that, I think, I really did great. So I appreciate all the help from the staff at physical therapists, because they really encouraged me, and the doctors and the nurses really encouraged me, and it was really nice. And I'm gonna try to get a picture of this sign. Let's see. My phone never acts right. Never mind to that. But anyways, guys, like I said, my experience with the pre-transplant and the post-transplant, hi girl, was a great experience, and the front. I'm You're very welcome. Finally starting to feel a bit better with the back pain. It's starting to actually get better, and I have been noticing since I've been stretching my body out in the gym and doing my arm exercises, the one that you guys see me posting sometimes, that has really helped to stretch my upper part of my body out. So it could, be just pain from laying down and being in the hospital for so long, and I'm was always laying down, and so it could just be that. And it's starting to feel better. It's still there. I'm still on my muscle relaxers as well, so I'm also going to be sent to pain management. They're not going to give out any medication, but they're going to just try to get to the bottom of it to see what it is, and maybe some massages, and maybe injections if I need injections in my back. But they're not saying exactly what they're going to do until I get there, so we'll see how that goes. And hopefully that'll be happening sometimes this month, and I'll keep you guys informed on that situation as well. So with that being said, I'm going to go ahead and get ready to go back. Hopefully they'll be calling my name in a few, and I'll let you guys know how this experience goes with this first appointment. And you guys have a lovely morning, and I will see you guys later. Love you all.